I now recognize myself for 5 minutes of questioning. Constituents in my district in Arizona, the Phoenix metropolitan area, go to a number of hospitals that use a 340B program. Banner Thunderbird Medical Center and Honor Health Deer Valley Medical Center are both in my district. Plus, close by is Banner Estrella Medical Center, Banner University Medical Center, Phoenix, Honor Health Johnson C. Lincoln Medical Center, Phoenix Children's Hospital, which is building a hospital right in my district, and St. Joseph's Hospital and Medical Center. Today's hearing is on topic. Because it has a significant impact on constituents in my district, particularly the over 250,000 senior citizens who have health care coverage under Medicare. Many of them depend on hospitals participating in the 340B drug pricing program for medical care. In fact, two of the largest hospitals in my district, Banner Thunderbird Medical Center and Honor Health Deer Valley Medical Center, are 340B covered entities. Banner Thunderbird Medical Center reports using the savings from the program to offer increased access to mental health treatments, extended clinical hours, and to hire additional medical and support staff. Many safety net providers report concerns about their ability to maintain operations without the program. Dr. DiGiorgio, sorry I messed your name up. In your written testimony, you mentioned that you believe Congress should change the eligibility standards hospitals must meet to qualify as a covered entity under the 340B program. Could you explain how increasing the eligibility percentage to qualify as a disproportionate share hospital would benefit patients?
It would ensure that this discount is going to the hospitals that truly do reach out and take care of disproportionate share patients. There's a lot of bad behavior by hospitals that claim DISH status and don't actually live up to that mission. They act more like large consolidated conglomerates. They do predatory debt. They go after patients for predatory debt. They transfer patients away from their hospital when they realize that they're uninsured or underinsured. And so holding them to a higher standard, I think, would help overall care. But in the bottom line, I really do believe that this discount should follow the patients, and the patient should be able to direct it. I believe in market forces, and I believe that allowing the patients to control where this discount goes would truly help them pick the best place that is unique to their specific needs.
And also to you, sir, do you think increasing the requirements for hospitals to become 340B covered entities, would it make it more difficult for low-income individuals to have access to affordable care?
No, I don't believe so. I think part of my recommendation was also including outpatient visits as well. And so by including outpatient services, that would encourage these hospitals to reach out to those patients and provide services to help them get their outpatient visits. Right now, outpatient visits are not included in the DISH calculation. And because of that, there's very little utilization, or utilization skews towards inpatient for low-income patients because they don't have access to primary care, because there's simply no incentive for outpatient clinics to reach out to these patient populations. Again, as I mentioned earlier, they have special needs in terms of transportation and support networks. So a lot of these clinics could be incentivized to reach out to these patients if that was included in the outpatient metric as well.
And do you believe what do you believe the role of contract pharmacies should be in relation to the 340B program?
I think if the DISH percentage was fixed and it was allowed to follow the patient, I don't see a problem with where they could get their medications. I think there's established hospital referral regions. The Dartmouth Atlas has this that describes a certain hospital's referral region, and simply limiting contract pharmacies to that referral region would be effective.
Thank you, and my time is almost expired.